Hello friends, welcome to Bunk. I'm Dr. Khushboo and today's topic is cerebrovascular accident. So as the name suggests cerebrovascular accident, so what is basically you have to understand about the cerebrovascular thing. Cerebro refers to the major portion of the brain, right? That is cerebral cortex. So what is the major portion you understand? This cerebral cortex. Okay, so when the cerebral cortex, like they are supplied with arteries and veins, that is what called vascular. So these are vessels basically, which are arteries and veins. Okay, and cerebral here refers to cerebral cortex. So the cerebral cortex, any pathology of blood vessels that leads to any pathology of blood vessels that lead to any area of infarction inside the cerebral cortex or the subsequent brain area. So that is what calls cerebrovascular pathology. So you understand about stenosis, right? In case of stenosis, so what is stenosis? First, we have to understand the underlying term. What stenosis is basically narrowing of the blood capillaries. Okay, narrowing of blood capillaries. Okay, so this one is stenosis. Okay, and another one is you can say embolism. Okay, and thrombosis. So in this case, when of course thrombosis, you understand this is a blood clot. Okay, um, or even in case of hypertensive disorder, when there is a hypertension. Okay, so when there is a high blood pressure or hypertensive disorder is there, or even in case of hypercholesteremia. Okay, so in case of hypercholesteremia, you can admire the sufficient supply of blood which is required, the required amount of blood which is required to the brain for their normal functioning, when it is hindered. Okay, so what will happen in case of embolism, in case of thrombosis, in case of hypertensive disorder? So these are different things. Okay, so it will lead to rupture of the blood vessels. But in case of stenosis, when there's a narrowing of blood capillaries, embolism, and in case of thrombosis, what will happen? That particular area, there will be hindrance. Okay, so hindered blood supply. When there is hindered blood supply, what will happen? It leads to infarction of that particular area. It leads to infarction. You can admire here infarction. Okay, so it leads to infarction of that particular area. So when there is infarction, so there will be a lack of nutrient and lack of oxygen, anoxia you can say. So anoxia and lack of nutrient, with the because of that, the respective tissue around the surrounding tissue, we can basically say, surrounding tissue will die. Okay, so it will get damaged. The particular area which is having the lack of blood supply, proper lack of blood supply, that area will get damaged. Okay, so this is what called ischemia. So ischemia is what? When there is a, like within few minutes, you can admire there's a the neuron cell will die. Okay, and again, if what is hypertensive and hypercholesteremia? So when there is hypertensive disorder or when the cholesterol level is high inside the blood, what will happen? The there it will lead to rupture of the fine blood capillaries. Okay, so fine blood capillaries will get ruptured. In this case, you can see the fine blood capillaries will rupture. Okay, so you can see the branches of carotid artery which is supplying blood to the brain. So anyway, like any breach of the artery will lead to what? Any breach, like any cut you can see, any breach in the artery will lead to rupture of the particular hemorrhage. So if there is any breach in the artery, there will be hemorrhage. So blood will go all over the tissues and there will be hemorrhage. Okay, so this is how branches of carotid artery which is supplying blood to brain, when any breach or any cut, or like any cut, you cannot say cut. Basically, what will happen in case of hypercholesteremia or in case of hypertensive disorder? The blood leaks out because the fine cellular capillaries you can see here. So these cellular capillaries, these fine cellular capillaries will rupture and blood will come out. So when blood will come out, it will of course lead to blood clot. So in this area, when suppose it is ruptured, in this area blood will come out and this respected area will get infarcted. So because of that infarction, okay, Because of that infarction, what will happen? There will be lack of blood supply and nutrients, and again, what will lead to ischemia. Okay, so anyway, in case of hemorrhage or in ischemia, there is a lack of blood supply, lack of oxygen and nutrient to the particular area of neuron, and the cell start dying off. Okay, so let's understand the type of stroke we are dealing with. It's basically ischemia, and another one is hemorrhagic stroke. Okay, ischemia we already know because of the stenosis thing. Because of stenosis, when there is a narrowing of blood capillaries. Okay, so because of stenosis, and of course because of thrombosis, because of these things, stroke will happen. And in case of hemorrhagic stroke, you can admire when the fine blood capillaries are getting ruptured. Okay, when fine blood capillaries are getting ruptured, in that case what will happen? Blood will leak out from, and the respective area where it is leaking, it will cause blood clot, and that leads to paralysis. Okay, so quadriplegia, paraplegia, hemiplegia, whatever plegia is occurring, it depends upon the site of the lesion where the blood is flowing. Okay, so what is the common type of stroke? In case of hemorrhagic stroke, you can admire. The hemorrhagic is what? When the bursting of blood capillaries. Okay, when fine blood capillaries burst. So bursting of capillaries, it leads to hemorrhage. And why these blood capillaries are bursting? Because of two reasons. When there is a hypertensive blood, okay, and another is hypercholesteremia. In both the cases, they all are synonym terms, hypercholesteremia. In both the cases, what will happen? The narrowing of blood capillaries will occur, and then stenosis also is a narrowing of blood capillaries. In both the cases, what will happen? The efficient supply of blood, whatever is required, is not getting properly, so it will lead to dying of the cell. In hemorrhage, when it bursts, anyway, the fine capillary is bursting because of hypertensive disorder, because of high blood pressure, it bursts, and then wherever blood goes, the area leads to infarction, because after the hemorrhage, there's a blood clot, which is what called thrombosis. In ischemia, we have discussed like lack of proper lack of proper blood supply. Okay, so when there is lack of proper blood supply, what will happen? Will lead to infarctions. Infarction will lead to what? The respective area of the cell neurons, they die. And the other one is atherosclerosis. So when suppose this one is fine blood capillaries and plaque is being formed here. This one is plaque. So this plaque is because of cholesterol, or sometimes there is calcium ion deposition also. So it will lead to the narrowing of the blood capillaries. So when blood will flow, it will like blood, the efficient amount of blood is not going to supply to the respective area. So what will happen? Again, it will lead to ischemia, or when hyper blood pressure is there, so then that will lead to hemorrhage, and then later on to the blood clot called thrombosis. Now, we admire these types of stroke, like in case of hemorrhage, when the weakened blood vessels rupture, and we admire the transient ischemic stroke because of the temporary clot. Because of course, when the spine blood capillary is going to rupture, it is going to form a clot. But if it is very little bit of it, so a very bit of fine stroke, or fine thrombosis or fine blood clot can be seen. So that is a transient, that's mini stroke. It's giving you a sign like mini stroke is what? It's giving you a sign that it may occur major. So prepare yourself or treat yourself with the drug so that this type of stroke is not gonna come back. So this is how mini stroke is giving you signs and signals to avoid the major attack. And the ischemia, what is happening due to stenosis or to some other region like thrombosis or embolism, what will happen? There will be obstruction within a blood vessel, so supplying blood to the brain. So in that case, there will be lack of oxygen and lack of nutrients. So this term here, this written lack of oxygen, is anoxia. So when there is a lack of oxygen, it is called anoxia. the oxygen is not getting supplied properly to the area of the brain tissue. So what will happen? It will again gonna die. So this dying of tissue is leading to paralysis. So whatever particular area of the brain is innervating the particular type of uh, organ, that organ is gonna paralyzed. So three strokes type we have discussed, like clogged occluding artery. So when there's a mild, even a mild hemorrhage, in case of that also, there will be a blood clot. So blood clot is what doing? It's obstructing the further flow of blood. Suppose we can say, we can admire a blood vessel here, and there's a proper, like this type of supplies in here. It's like that. So if the blood clot is here somehow, okay, so is the blood gonna go forward? No. So these all area which is because of lack of blood, of course, they will undergo ischemia because the blood clot is inside that blood capillaries which is going to supply the further part of the brain. It's not gonna supply because of that particular blood clot which is being stuck here. So surgically, what surgeons do, they remove out this blood clot so that the blood supply gonna proper to the other area of the brain. But that time, since the surgery is being conducted at the time the patient is reaching to the hospital, what will happen? This area, you can admire this area of the brain, what will happen in that case? Cell die. Neuron cell, basically, you can say nerve cells die. And when the nerve cells die, they're supplying to the particular area of the part of the body, what will happen? It get paralyzed. So paralysis of the limb. Even you can say quadriplegia, when all the four limbs are paralyzed. Periplegia, when half of the body is paralyzed, okay? And hemiplegia, the lower half is paralyzed, is periplegia, and the hemiplegia is the one, either right half of the body or the left half of the body is paralyzed, okay? So this, all the kind of stroke may lead to any kind of paraplegia, hemiplegia, quadriplegia, it just depend upon the site of the lesion, right? And intracranial hemorrhage, when blood is flowing, when blood is flowing to the particular area of the brain inside itself, not the outer world. And subarachnoid hemorrhage is what? When blood flows outside, like outer part. When it is inner part, it is intracerebral hemorrhage. Okay. Subarachnoid is what? When it is bleeding around the brain, like arachnoid membrane, you admire the meninges of the brain. So there was a pyometer, arachnoid membrane, durameter. Okay. So diameter is the inner one, so intact with the brain. So in between this area, when there is a, meninges is there, they are pushing the area of the brain because the blood is all over around the brain. So it's a subarachnoid kind of hemorrhage. So I think you understand about the ways of reasons and why the stroke is going to happen. So because of the stenosis, okay, because of thrombosis, okay, because of embolism, because of hypercholesteremia, hypercholesteremia, because of hypertensive blood disorder. Of course, no try in artery, the accidental case or in road accident and many other things, even the patient fall somehow. So it may happen. So anything can happen. But what we need to focus here is any sort of pathology of cerebrovascular disease will lead to a cerebrovascular disorder. It's an umbrella term called stroke. So stroke, we can admire stroke is what? Stroke is not a disease. It's several types of pathology. Okay, several pathology leads to a similar condition called stroke. And stroke is a very vast umbrella thing which is going to damage your body in very bad manner. Like it may happen like no recovery occurs through all of the life. So let's understand stroke in bit detail in our next lecture. So in next lecture, we are going to understand what are the consequences and how we can overcome with this particular kind of disease. So till then, let's hope, let's think like what the effect of strokes and how can we can get rid of it. So this is how we can understand stroke, and then we can acknowledge stroke, and then we deal with the stroke and the patients suffering from this particular kind of disorder. So we will, of course, in the next lecture, we're going to discuss about the things. Thank you.